Hi, welcome to NCLEX over NCLEX. This video contains practice questions about fundamentals of nursing. Don't forget to pause the video to have more time to understand the full question. Question number 1. The nurse is preparing a client to be turned in bed. In what position would the nurse place the client to begin this procedure? A. Lying flat. B. Sitting up. C. Lying flat with feet raised slightly. D. Lying prone. Answer A. Lying flat. What nursing organization first legitimized the use of the nursing process? A. National League for Nursing. B. American Nurses Association. C. International Council of Nursing. D. State Board of Nursing. Answer B. American Nurses Association. A female patient who is receiving chemotherapy for breast cancer tells the nurse, "The treatment for this cancer is worse than the disease itself. I'm not going to come for my therapy anymore." The nurse responds by using critical thinking skills to address this patient problem. Which action is the first step the nurse would take in this process? A. The nurse judges whether the patient database is adequate to address the problem. B. The nurse considers whether or not to suggest a counseling session for the patient. C. The nurse reassesses the patient and decides how best to intervene in her care. D. The nurse identifies several options for intervening in the patient's care and critiques the merit of each option. C. The first step when thinking critically about a situation is to identify the purpose or goal of your thinking. Reassessing the patient helps to discipline thinking by directing all thoughts toward the goal. Once the problem is addressed, it is important for the nurse to judge the adequacy of the knowledge, identify potential problems, use helpful resources, and critique the decision. The nursing process ensures that nurses are person-centered rather than task-centered. Rather than simply approaching a patient to take vital signs, the nurse thinks, "How is Mrs. Barkley today? Are our nursing actions helping her to achieve her goals? How can we better help her?" This demonstrates which characteristic of the nursing process? A. Systematic. B. Interpersonal. Circa dynamic. D. Universally applicable in nursing situations. B. Interpersonal. All of the other options are characteristics of the nursing process, but the conversation and thinking quoted best illustrates the interpersonal dimension of the nursing process. An experienced nurse tells a beginning nurse not to bother studying too hard, since most clinical reasoning becomes second nature and intuitive once you start practicing. What thinking below should underlie the beginning nurse's response? A. Intuitive problem solving comes with years of practice and observation, and novice nurses should base their care on scientific problem solving. B. For nursing to remain a science, nurses must continue to be vigilant about stamping out intuitive reasoning. C. The emphasis on logical, scientific, evidence-based reasoning has held nursing back for years. It is time to champion intuitive, creative thinking. D. It is simply a matter of preference. Some nurses are logical, scientific thinkers, and some are intuitive, creative thinkers. A. Beginning nurses must use nursing knowledge and scientific problem solving as the basis of care they give. Intuitive problem solving comes with years of practice and observation. The nurse uses blended competencies when caring for patients in a rehabilitation facility. Which examples of interventions involve cognitive skills? Select all that apply. A. The nurse uses critical thinking skills to plan care for a patient. B. The nurse correctly administers IV saline to a patient who is dehydrated. C. The nurse assists a patient to fill out an informed consent form. D. The nurse learns the correct dosages for patient pain medications. E. The nurse comforts a mother whose baby was born with Down syndrome. F. The nurse uses the proper procedure to catheterize a female patient. A. D. Using critical thinking and learning medication dosages are cognitive competencies. Performing procedures correctly is a technical skill. Helping a patient with an informed consent form is a legal, ethical issue, and comforting a patient is an interpersonal skill. A nurse uses critical thinking skills to focus on the care plan of an older adult who has dementia and needs placement in a long-term care facility. Which statements describe characteristics of this type of critical thinking applied to clinical reasoning? Select all that apply. A. It functions independently of nursing standards, ethics, and state practice acts. B. It is based on the principles of the nursing process, problem solving, and the scientific method. C. It is driven by patient, family, and community needs as well as nurses' needs to give competent, efficient care. D. It is not designed to compensate for problems created by human nature, such as medication errors. E. It is constantly re-evaluating, self-correcting, and striving for improvement. F. It focuses on the big picture rather than identifying the key problems, issues, and risks involved with patient care. Answer: B, C, E. Critical thinking applied to clinical reasoning and judgment in nursing practice is guided by standards, policies and procedures, and ethics codes. Thank you so much for watching. There will be more questions about fundamentals of nursing coming up soon. Let me know in the comments below what questions from your classes you prefer me to upload. Don't forget to like, comment, and subscribe.